Today, we're diving into an important topic: depression, a widespread and serious mental health condition that affects how you feel, think, and behave. Depression isn't just feeling sad. It can strip the joy from activities you once loved and make everyday tasks feel overwhelming. It can impact your emotional well-being, physical health, and ability to function at work or home. What causes depression? There's no single cause of depression. It often results from a combination of biological, psychological, and environmental factors. Let's look at some of the most common contributors. Brain structure and chemistry. Research shows that people with clinical depression often have a smaller hippocampus, the part of the brain that helps with memory and emotion. This area also tends to have fewer serotonin receptors. Serotonin is a key neurotransmitter that influences mood, and low levels are often linked to depression. Abuse and trauma. Experiencing physical, emotional, or sexual abuse, especially in childhood, can increase vulnerability to depression later in life. Conflict and relationships. Personal conflicts, whether with family, friends, or partners, can trigger depressive episodes. Loss and grief. The death of a loved one or any major loss can lead to profound sadness, or even clinical depression. Genetics. If depression runs in your family, you may be at a higher risk of developing it yourself. Major life changes. Events like graduating, getting married, moving, losing a job, or even retiring, though often seen as milestones, can be emotionally overwhelming. Chronic illness. Depression is commonly found alongside serious medical conditions, like heart disease or cancer, and can also be a direct response to illness. Substance abuse. Around 30% of individuals with substance abuse disorders also struggle with depression. Common signs and symptoms. Depression can show up in different ways for different people, but here are some typical signs: persistent sadness, hopelessness, or emptiness, irritability, anxiety, or feelings of guilt, fatigue or a constant sense of exhaustion, trouble concentrating or remembering things, sleep issues, either insomnia or oversleeping, appetite changes, eating much more or much less than usual, physical symptoms like headaches, stomach issues, or body aches, mood swings, emotional outbursts, or tearfulness, loss of interest in daily life, relationships, and hobbies, thoughts of self-harm or suicide. Diagnosis. There's no single test to diagnose depression. Doctors usually start with a detailed medical history and physical exam. They'll ask about when symptoms started, how severe they are, and whether there's a family history of mental health issues or substance abuse. Treatment options. If no physical cause is found, your doctor may begin treatment or refer you to a mental health specialist. Treatment often includes medication. Antidepressants can help regulate brain chemistry. Therapy. Psychotherapy, also known as talk therapy, helps explore emotional causes and develop coping strategies. Combined approaches. Many people benefit from a mix of medication and therapy, tailored to their individual needs. Thanks for watching. If you found this video helpful, please give it a like, share it with someone who might need it, and don't forget to subscribe for more videos on mental wellness and health.